The Aus-InSCI Translation Project is all about trying to improve the lives of people with spinal cord injury by making sure their voices aren't just heard, but turned into meaningful change.
So the Aus-InSCI Community Survey is the Australian part of the huge international, or the global, I would say, survey for people living with spinal cord injury. And in the translation project, we want to take the results from the survey and we want to turn those results into some meaningful improvements for people. The second survey is currently underway, and we would like to acknowledge Professor James Middleton and Dr. Mohit Arora from the University of Sydney for leading the charge.
Our mission is pretty simple. We want to take what we've learned from the community survey and turn it into real co-design solutions. This means working alongside stakeholders, informing policies, and helping create improvements across the whole system.
So when we looked at the results from the survey, we could see that there are so many potential priority areas for us to focus on in the translation project. And we need to narrow those down into a manageable number. That's why we use the Delphi study that will help us bring together the experts, but also consumers, and come up or agree on a manageable number of topic areas. Then once we get those topic areas, we also want to look at what's already out there, like what initiatives are already available or what's already in progress, just so that we are not reinventing the wheel.
The project's hosted by the Hopkins Centre, which is a joint initiative between Metro South Health in Brisbane and Griffith University, and is led by Professor Tim Geraghty. It's funded through the National Injury Insurance Scheme Queensland, and it builds on a pilot translational project that was run by Dr. Delina Amsters back in 2021. The project is guided by a national steering committee, and it also has a consumer advisory committee, which is made up of 9 people with lived experience of spinal cord injury. Importantly, the chairs of this committee are also sitting on the steering committee, which helps make sure that lived experience helps guide and shape the direction that the project is heading. We're really excited by this project because it brings together data, research, lived experience, as well as having national buy-in to drive real-world change.
And we would love for you to be a part of it. If you'd like to be involved or stay informed, just send us an email or join our mailing list, or you can also visit our webpage for updates.
Together we can make sure that the voices of people with spinal cord injury continue to shape a better future.